Collins.
Thank you. Ms. O'Connell, over the past 2 years, Congress has appropriated $82.6 billion specifically for testing. In addition, we've given the department flexibility to use other sources of funding. And yet, as you've heard repeatedly today, our frustrated constituents cannot find rapid tests when they need them. This testing crisis appears to have been entirely preventable, as is evidenced by the widespread availability of rapid tests in Europe, for example. The fact is that it appears the administration simply failed to anticipate our testing needs. As the former Assistant Secretary of Health recently pointed out, a lack of federal orders for tests between January and September of 2021 caused the manufacturers to reduce their lines and lay workers off, including at Abbott facilities in the state of Maine, where 400 workers were laid off. As a member of the Appropriations Committee, I share the concerns that have been expressed by Senators Burr and Blunt. I don't believe that we're in the position that we are in now due to a lack of funding, but rather a lack of planning. My question to you is, has any of this funding, this close to $83 billion that was supposed to be used for testing, been diverted for other purposes?
Senator Collins, thank you for this question. Testing remains a priority for this administration, and all the work we've done on testing has been to promote the priorities of expanding the number of testing sites available, expanding the type of tests that are available for use in the United States, expanding the supply of tests in the United States, and lowering the cost of tests. And we used the $47 billion that came in the American Rescue Plan. $10 billion of that went to schools, through the states to set up the school testing programs. $8.3 billion has gone to community testing sites, including for the uninsured and at the community health centers and the pharmacy program Dr. Walensky mentioned. $5 billion has gone to procure tests and supplies, and an additional $4.5 billion will go towards this $500 million that we are in the process of procuring. $29 billion has gone directly to states from previous supplementals for them to build and promote testing programs within their jurisdictions. The testing money, as you recall, was for testing, contact tracing, and mitigation efforts. And some of the funds have been used for mitigation efforts. For example, when children are crossing the border, one of the responsibilities that we have within HHS is to make sure that anyone who is, that the children that are unaccompanied are cared for. And we used some of the funds to test those children and then to separate them from COVID-negative children at the border.
I'm going to repeat my question because you did not answer it. Has any of that money been used for non-testing related purposes at the border?
For the mitigation purposes as well, which the legislation allowed the funding to be used for.
I will follow up with you because I don't feel like I'm getting an answer. Dr. Fauci, just last week, the president once again said that COVID-19 is a pandemic of the unvaccinated. And let me make very clear that I've encouraged vaccinations. I believe in them. But contradicting the president's statement, in Maine, our largest health system reported that absences of vaccinated staff caused by COVID-19 last week was at the highest point since vaccines became available. It's increased by fourfold. Does the message that COVID is a pandemic of the unvaccinated still hold true with the emergence of Omicron? And do you agree with the New York Times, which has twice reported that while the COVID vaccine is critical in preventing hospitalizations and death, it is less effective against the Omicron variant?
Thank you for that question, Senator. Yes, indeed, it is. There's no doubt that the Omicron variant, when you look at the protection against symptomatic disease and asymptomatic infection, dramatically goes down to about 30%. What maintains itself, it goes up to about 70, it's about 70% against severe disease. When you boost, what happens is you get a rather significant reconstitution of the protection, particularly against hospitalization. So if you were to say that Omicron, or even COVID-19 as it is really a pandemic, when you're talking about pandemic that causes serious disease, there's no doubt that there's an extraordinary divergence of risk between a vaccinated and an unvaccinated person. In response to the question just a bit ago, when I said that if you look at vaccinated versus unvaccinated, there's a 17 times greater chance of being hospitalized and a 20 times greater chance of dying if you are unvaccinated versus vaccinated.
Thank you. Senator Hassan?